Hey mommies, how are you? So today I was actually the other day doing some research and some stuff about different breastfeeding products, and I kept coming up about a lot of conversations and topics of conversations about thrush and about yeast infections and stuff like that. So I've never actually suffered through anything like that, but I started to read a lot about it, and some of the causes of yeast infections and thrush and things like that are actually very easy to make. So I just wanted to share some of those with you and talk a little bit about that, because it's actually yeast infections are very, very common. Especially it's basically like a fungus or a bacteria that grows in the baby's mouth. And it can be a cause of a lot of different things. Like, for example, if once a baby's born, when it goes through the vaginal canal, it can acquire the yeast through there, and then it starts to grow in the baby's mouth and the baby's stomach and things like that. And the reason why babies are very prone to it is because it's actually through like an imbalance of the good bacteria and the bad bacteria. So what can happen to if babies are given antibiotics, or moms given antibiotics to after the birth or during the pregnancy, then what can happen is that the antibiotics fight off the bad bacteria, but also they kill off the good bacteria. So there's like an imbalance there. So then what can happen is then that yeast grows in the environment of the mouth or the stomach. And then what makes it even worse is that the way that yeast kind of thrives and grows is in a moist, warm environment with sugar. Sugar makes it thrive even more. So we all know where we have a lot of nice milky sugar in our breast milk, so it tends to overgrow there too. And then what happens is that through breastfeeding or nursing, we pass it back and forth from the baby to us, from the baby to us. So it can be a little bit difficult to get rid of it. It's nothing like mega serious or anything like that. It can cause a little bit of pain when you're breastfeeding. And then one of the main symptoms that it causes is it causes like lumps in the baby's mouth. So you'll see like little white cheesy spots, like a little bit like a milky tar type thing in the baby's mouth. So it definitely needs to be treated. Very, very important that it's treated. It's treated with oral creams and things like that. But more importantly than anything else, the best way that you can prevent it is through like really, really close hygiene. And I know we're all very hygienic using our antibacterial and stuff like that, and that's fine. But the reason why I wanted to kind of bring it to your attention is because I've done it in the past, and I use a lot of these nursing pads. I use the disposable and the washable, which are these. And what can happen is, obviously through letdown that collects in that pad is nice and warm and moist and has a lot of nice sugar there from your breast milk. So that's where a lot of the yeast can grow. And then what can happen is we usually tend to, well, I've done it in the past before. I'm like, oh, well, maybe there's just a few drops of milk there. I'll just use it the next day, or I'll just use it through the night. And then the longer you leave it there, then the more you're likely to maybe get like a yeast infection or something there. And then even worse, if you don't wash your pads right away, then that can only make it even more likely. So make sure that if you do use pads like these, if you use the disposable ones, make sure that you're using them like, in a 6-hour, 8-hour window, and then replacing it. And then the other thing is, make sure these pads, you wash them pretty quick, like within like 24, 48 hours after you use them, and make sure you wash them in a sanitized cycle in your wash, or you put them in boiling water before you put them in the wash. That's something else that you can do. And then the other thing is, make sure if your baby has any pacifiers, any bottles, anything like that you're sterilizing all of that. So anything that comes in contact with your baby's mouth. And the same, make sure that when you are bathing, that you really wash really well your nipples and your breast and have them nice and clean, because you want to avoid all of those things that can just create more of that environment for the fungus to grow. So just wanted to share that with you, mommy, so you don't get scared or anything like that. There are a bunch of other symptoms that you can tell that the baby has other than the mouth. Also through in the baby's diaper, you can see different, like if it's like a really thick rash that it's raised, That's another way you can tell that the baby has the yeast infection. So there are a few different ways, but the main one is the one with the like milky lumps in the mouth around the cheeks inside and the lips too. So just be aware of those things, but I really wanted to bring attention about the pads. It's really important that you clean them really, really well to avoid things like that, because these are my lifesaver. If not, I would walk around with huge patches everywhere on my t-shirt and stuff like that, and I hate those. It's like, oh, when you feel that little warmth, oh man, I'm leaking. So make sure that you do clean your pads really well. And if any of you have had yeast infection or anything like that, how have you dealt with it? Make sure you let us know. Was there a specific type of cream that you used? You know, what did your pediatrician recommend? I've never actually suffered through it, but I know that it can be very uncomfortable. And I've definitely seen a lot of issues come up with from using pads and things like that. So you really have to make sure that you know how to take care of your pads and things like that, because they're lifesavers, but it is cloth, so you need to make sure that you know how to use it. Okay? Bye, mommies.